All right. Well, welcome to another episode, Next Gen Nursing, helping you succeed through nursing school, right? Let's get right down to the nitty-gritty. Skip all the formalities here. We've got some language to discuss, some topics, something very interesting. It certainly helps tell the story about our future clients or patients, right? If we're, following our NCLEX test plan, right? Whether for RN or PN, doesn't matter. Manage care or management of care is a large component, right? The other aspect that we need to think about is next generation NCLEX testing case study style questions, right? How are we going to apply the nursing process? What is going to be our across our head to toe, of course, with cranial nerves, yes, but that first initial, I'd like to call the across the room assessment, right? How can we recognize cues or clues within our patient? And I'd like to say that hair, skin, and nails paints an illustrious picture of a client's overall health and wellness. Remember that the skin is the largest organ of the body. Oh, yeah, it covers at least 20 square feet. That's huge. If you've ever been to a bodies exhibit or maybe Google it, you'll be able to see the skin in its entirety, right? So the skin helps us sense what's happening around us, right? Trauma, pathogens, dirt. Okay. That's from the basically the environmental stresses. Skin also helps us adapt. Adapt can cool us down, um, essentially plays a role in warming us up. Skin's got a couple of layers we're going to talk about. The epidermis, right? At the top, the piece that you can touch. And then what's beneath it in the middle? The dermis. Think about where your needle goes. I've got a video on hypodermic needles as well. Subcutaneous tissue, right? You got your three main layers. Guys, the best way to learn this, well, I shouldn't say the best way because that's all the beauty is in the eye of the beholder, right? But what is a suggested way to learn it? It can be considered a forgotten skill is labeling with your hand, drawing, coloring, labeling, and defining the vocabulary words of essentially the structure and function of the skin, hair, and nails. Some glossary terms we'll go over too. I think that would be essential into learning about this vital organ along with its structures and stratified layers, really. So let's get into it. The epidermis, although thin, super tough. Okay, the cells are really kind of bound together to perform protection, like a protective barrier, if you will. Okay, and essentially, the skin is made out of many elements and ingredients, but we're going to focus on one of the major fibrous proteins, which is keratin. Our hair is made out of that too, right? But what else the skin provides? That again, that protection. It has some sebaceous glands, eccrine glands, apocrine glands. You're going to learn about that as far as sweating goes. Hormones, oils that are essential, no pun intended, right? So let's continue into the skin, right? What can the eye see? Well, we see the skin as the protective layer. And then the skin presents with melanocytes, which are basically spread out along the layer to produce what we see with the eyes as pigmentation due to melanin, right? Quintessentially, people of all skin tones have the same number of melanocytes, but thanks to genetics, hormones, and environmental influences, you'll see the different tones or pigmentation we know as melanin, right? Now, the skin has a few other layers too to give mention to. You have the horny cell layer, the basal cell layer. So if you're following in your text, I am on the chapter, depends on what edition that you're using. Okay. I am tonight referencing the Jarvis Physical Exam and Health Assessment book. Okay. So again, this podcast is based on the research and productions of the book, and I have no financial ties to this book. I should say, there's a word for that. Can't think of it. Conflict of interest. There we go. Okay. Again, strictly educational. Did you know that the epidermis is completely replaced every 4 weeks? Oh, yes. Hygiene should be the first thing to come to mind. We are constantly shedding skin cells, which is why we need to bathe, shower, cleanse the body, cleanse the entire perimeter of the skin. Because as we're learning, okay, that epidermis every month, we get some nice new skin cells. Maybe explaining it like that is a little bit interesting because as we age, we lose elasticity in our skin because as we age, we lose collagen. But for right now, we're on the health assessment topic of the skin, hair, and nails. Now, you ever notice the palms and the soles of the skin is thicker? Well, think about the weight we have to bear on those, the work we have to do. Fun fact, the epidermis is essentially avascular. Okay, it's without vascular areas. There's no veins or arteries found in the epidermis. You got to get down a little deeper, right? Interesting. Although the capillaries do nourish, along with the other blood vessels found in the dermis. Okay. Now, again, we were talking about melanin, melanocytes, skin tone or color. Again, there's some three major resources, right? Brown pigment, melanin. The yellow-orange tones of pigmentation is keratin, C-A-R-O-T-E-N-E, or carotene. And red-purple tones are from an underlying vascular bed. Oh, yes. Interesting stories, right? So we all of us, we do share varying shades of this red, brown, and yellow. Okay. And again, skin coloration is further modified by the thickness of the skin or discolored, potentially due to edema, swelling in the skin, right? Some fluid collection, which is quite interesting when we get into that part of our health assessment topic. Now, the dermis is where you're going to find that supporting layer, connective tissue. Okay. This might be an exams topic here. We need to correlate the dermis with collagen. Okay. Thank you to protein because that helps us resist skin tears. When our skin is thin, as we age, we're going to have some age-related changes or alterations. Reduction of collagen. We'll have a reduction of protein our intake. Anyway, I won't turn this into a gerontology discussion. I'll keep it focused, pardon me. Now, we need to remember that nerves, sensory receptors, blood vessels, and interestingly enough, yes, the lymphatics lie in the dermis. Okay, then we have hair follicles too. Don't forget about them. And then I mentioned already the sebaceous glands and sweat glands, apocrine glands. Okay, got some hormone secretion that comes from the skin, which helps us maintain regulation, even temperature regulation, if you think about it. We're going to get to there. There is the subcutaneous layer, which if you think about giving an intradermal, where does that go? It goes in the dermis. It's about a 15-degree angle. If we're going subcutaneous, well, depending, we can go 90 degrees or 45-degree angle. And there's different lengths of needles depending on what area of the skin that you're going into. So that's a whole nother podcast. Oh, yes. Right now, I'm going to keep it in this. I'm going to keep on focusing here. Now, what else does the subcutaneous layer do? Well, I will certainly speak for this one. It stores our adipose tissue or our fat cells, right? You're in nursing school, so it is adipose tissue. We do store that for energy. It does provide us insulation for temperature control, and it provides a cushioning effect. Isn't that sweet? Okay. There is some loose subcutaneous layers though, and we're grateful for that as that it provides mobility, lets us bend, twist, move along with the nervous system and musculoskeletal system, interestingly enough. Now the hair, as mentioned before, yeah, it is made of keratin, Keratin. The hair shaft that you see, that's what you brush with your brush. It's what you wash in the shower, right? The hair shaft, that's the visible projecting part, and the root is embedded in the follicle. Okay. And there's many pictures online, guys. You can pull up of layers of the skin and the hair follicle, etc. You ever had goosebumps? You know, when your hair stands up on your arm and you're like, oh, look at that. My hair is standing straight up on my arm. What is that? Well, again, you're studying to be a nurse. So you're going to call that a rector pili. That is which your hair elevates and resembles a goose flesh. Think about when you're in an emotional state of mind, or you go outside in the freezing cold with the ice and the snow, perhaps, and you get a little chill. You can thank the hairs on your appendages, causing erector pili. Okay. We got two different types of hair to talk about tonight. Fine hair. Okay. That's the faint velous hair that covers most of the body. Now typically we do not have hair on the palms and the soles of our feet and the dorsa portion of the fingers. Unless you're me, I do have a little bit of faint hair on the back of my fingers. I did try to barbecue a few weeks ago and burnt that off. But anywho, people can have hair on the back of their fingers. We don't have hair on the umbilicus or the glans penis or inside the labia. Okay. But there is other types of hair though. You may have noticed maybe on your significant other. They got some maybe thick, dark hair that grows really thick, essentially on the eyebrows, inside the ear, protruding out of the ear, the nose. That's your terminal hair. And terminal hair could also be after puberty on the axilla, pubic region, face, and chest, if we're talking about males, interestingly enough. Sebaceous gland. Uh-huh. They are busy, 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 the sebaceous glands. But what in the heaven are they doing? They produce a lipid substance called sebum. Yeah. You may have provided yourself some hygienic care to your hair, and maybe in a few days or X amount of time between washes, you notice your hair may be a little bit oily, right? That is the sebum that comes out of the hair follicles and essentially helps us uh, lubricate the skin and hair. Um, so it's quite interesting. A lot of work the sebaceous glands are doing. We have those everywhere except for the palms and the soles. Okay. Got a lot of them in the scalp, forehead, face, and the chin, which is why some people do suffer from oily skin, oily hair. There are some people who have to shower every day because if they don't, the next day their hair is completely oil filled. To each their own. Thank you, genetics. Okay, now apocrine glands. Yeah, they're responsible for a milky-like substance to open the hair follicles. Now we're really talking about the axilla, nipples, navel, okay, in humans. This is the puberty time, okay? And the secretion happens with emotion or sexual stimulation. It does help us with some bacterial flora that resides on the skin that produces that characteristic musky odor. Okay. And that's a functioning apocrine gland, which does decrease as we age. So women, we may suffer feminine dryness thanks to the apocrine gland as we age, get older. Okay. Now the skin. You may notice this in NCLEX style case studies that the skin provides a few functions. Well, we've got it produces vitamin D. The skin is the surface where the UV light touches and converts cholesterol into vitamin D. Absorption and secretion of medicine, decomposition of minerals, sugars, and amino acids, cholesterol, uric acid, and urea. Interestingly, it allows limited excretion of some metabolic waste products that I just mentioned. We do reproduce skin cells for wound repair. You ever got a cut on your arm? Laceration, right? And the skin cells, we can regenerate skin cells with proper nutrition, of course, protein intake. Excuse me, young lady. Thank you. Now, communication. You ever got embarrassed? Maybe your face got warm and flushed, or visibly, potentially, maybe pink or red, blushing. That's nonverbal communication. We use our skin for identification, right? We have a fingerprint, the way we look, our faces, right? That's a unique identifier, some facial characteristics like our hair, skin color, and I already mentioned fingertips. I talked about temperature regulation, protection. Skin's barrier that stops the invasion, which is our first line of entry for infection prevention. The skin protects us from, um, well, losing water and electrolytes too. And we sweat. Okay. We sweat to cool the body down. Perception, neurosensory, touch, pain, temperature, and pressure. We'll talk about baroreceptors too soon, not right now, related to a few aspects or elements of the body. I'm going to keep it towards health assessment. Yes? Now, let's continue. We're going to talk about some of the subjective data that you may be able to collect during a head-to-toe intake assessment. We want to know about any past history of skin diseases, allergies. Ding, ding, ding. Every patient, every time. I don't care if you give your patients meds 8 times a day. At each one of those all 8 med passes, you will assess for allergies. Period and the end. Why? What's the rationale behind that? Allow me to elaborate on that for you. Your patient may forget that they're allergic to shellfish from 25 years ago. And one thing that science has taught us is that each time that the patient is touches or takes the allergen, the allergic reaction worsens. Okay, it's quite interesting how the body reacts and does what it does. Okay, some other changes could be eczema, change in mole sizes. We need to worry about that, okay? Change in mole sizes could mean quite a few things. So, changes in mole size. We're worried about cancers, okay? Squamous cell, possibly basal cell. What about dryness and moisture? Is there a change in that? Something we need to assess. Could be data. They could say, hey, I'm experiencing some dry eyes, which is new for me. Chemical and a chemical, maybe did they touch something? Are they a veteran? Pruritus. What about excessive bruising? Do they have all these micro bruises happening? Pruritus, petechiae, purpura. What's happening with them? Any rashes or lesions? Maybe they'll tell you some subjective information about medications, herbals, recent hair loss. What about changes in nails? You know, the nails are significant too. They tell a story. We'll get into it. Maybe they'll share some environmental or occupational hazards. Are they a housekeeper for the last 26 years and are touching chemicals all the time and now their eyes are dry? Or are they a veteran? And did they serve, right? Maybe they served in the military and they were around some toxic or some hazardous materials. And of course, we need to remember patient-centered care. Okay. Patient-centered care is we're putting the patient first and correlating the NANDA, the nursing process, and providing evidence-based practice. And we'll talk about what that means. Okay. Let's see here. Let's keep this rolling. So some of the questions, if they elicit some responses about subjective data, if we think about a change in, let's say, a mole size, we need to know the color, shape, size. Do they have any sores that don't heal? Are they bleeding? Are they itching? If they're reporting moisture or dryness, do they feel that it's all the time or is it just seasonal? Is there itching that's happening that wakes them up from their sleep? Where are they itching? When did it start? Are there any type of pains or soreness and where? So we need to get some specifics from the patient. If they talk about excessive bruising? Well, where is it? How? How long have they had it for? Okay. Discuss some medical terminology real quick. Anything with the cirrhosis, Xerosis is dry, and seborrhea, Seborrhea, that's oily. So if you see these medical terms maybe discussed in a H&P or history and physical, now you have an idea of what they are. And if these are new terms to you, no problem. It's a new language, new skill. You just have to embrace your spirit of inquiry and research the meaning, right? Or reach out to whoever your instructor is. Maybe me. Let me know. Okay. If they report a rash or lesion, well, when did it start? When did you notice it? Where is it at? Is it spreading? You want to assess the characteristic of it. Is it flat, raised, warm, tender? Is there any crust or odor? The duration. You want to know about their environment. Anybody in the home have a similar rash? Did they go camping, try new food? What makes it better? What have they done at home? What makes it worse? Is there any itching involved or fever? And assess what they think it could be, right? They may have some additional resources for you. Well, insight, really. Okay. Um, what's their hygiene practices? What's their ability to perform their own self-care at work or home or maybe even socially? Um, might sound like a loaded question, but you can assess too, is there any new or increased stress in their life? Are they going through a significant event? What's happening with them? That is holistic care, right? Mind, body, soul. If they talk about hair loss, well, is it symmetrical? Are they losing the same amount of hair on the left side of their head versus the right side of their head? Is there a fever? Is the stress increased? And is the hair loss like gradual, very slow over time? Or did it just happen really quick, like a sudden onset? Are they having unusual hair growth? Like women, if it's a woman, are they having any male pattern hair growth, like facial hair? Okay. Chest hair, back hair. Think about those aspects. Any changes in the appearance of their hair or texture? Can you stop? Okay. Nails. Did they bite or chew their nails? What's happening with them? Is there a change in the shape, color of the nail? Is it becoming more brittle, thickened, yellowed? Are we thinking fungus? Well, let's not put a medical diagnosis on it. That's for the doctor. We are collecting the data. Okay. Um, Again, we talked about some environmental versus occupational hazards. Did they get bit by something, right? Um, have they been doing some yard work and planted a new plant or maybe touched a plant that they're not familiar with recently? Patient-centered care also has to do with how do they care for their hair, skin, and nails, right? What kind of cosmetics, soaps, or chemicals do they use? Do they use adhesive for false fingernails? That can be an area to harbor bacteria and cause infection. We don't like that. Birthmarks, changes in the skin, jaundice. Those are really a pediatric consideration. I'm going to skip over peds and keep it adult right now. Not geriatrics yet, not yet. We want to know if there's any changes in their feet. Can they wear shoes? Do they have socks on? Can they bend over and put a sock on? Right? We're gonna think about that. Where, if they have a rash, where is it at? Because it could lead to diagnosis. We want to take care of them properly. Have they fallen? How many times? Do they have diabetes or peripheral vascular disease? And again, we can assess how they care for themselves. How do you care for your skin? Do you put lotion on? Do you wash your skin regularly? If it's dry, what do you do for it? What kind of maybe facial, skin, hair, nail care? How often, etc. Now, some fun facts here. What external variables influence skin color? Well, got some emotions we can talk about. When we're upset about something, angry, we got some vasoconstriction that happens. Okay. And it can cause a pseudo pallor, fake paleness, essentially. I already talked about when we feel embarrassed, we can get flushed in the face and the neck. Can look like fake or pseudo erythema. Okay. Same thing if it's hot. Causes vasodilation, redness. In case we want to worry about that erythema or redness. Anything cold or chilly is vasoconstriction. Cigarette smoking will cause vasoconstriction. Gives you a false sense that your patient appears pale. Same like with a cold room. Okay. Let's talk about some physical variables here. Prolonged elevation. Going to have some decreased arterial perfusion, causing some coolness and pollen. A dependent position, sitting for 8 hours a day, will cause venous pooling, redness, warmth, distended veins. Think about immobilization or prolonged inactivity. That's going to slow down your circulation, causing some coolness, paleness, pallor, and a longer capillary refill time, CRT. So we got to think about position, how often our patient ambulates, and how we can provide more to come on range of motion. You know, a great way to get a head to toe assessment done doesn't matter of what area of nursing you're in. A bed bath is a fabulous way to provide essential care to your patient. No matter if you are the RN, the LPN, the APRN, the DNP nurse, we can always take a portion from simply providing a bed bath. It will give you an essential overview of the patient, a complete head to toe. Not that you're not doing a complete head to toe. I know you are, and you're learning about it, but a bed bath is an opportunistic way to do a thorough skin assessment. You can, you can find bed sores. Maybe no one else assess the inside the gluteal fold. Just a moment, please.
Okay.
Wonderful, thank you. We want to make sure that we are assessing, inspecting, right? So normal the patient. We need to decipher, think whether these are normal range findings or abnormal findings. Is the skin tone even, right? Or is the finding of vitiligo happening, right? Absence of pigmentation in patchy areas of the skin. Okay. Does the patient have freckles? That can happen due to sun exposure, by the way. Are there moles? Because with moles, we may become concerned we would like to measure those and assess exactly the A, B, C, D, E, F's of a mole. A, symmetry, border irregularity. Oh, I'll get it for you. Thank you. Okay. Color variation, diameter, elevation or evolution, and funny looking. Is it suspicious? Stands out? What's happening, right? We want to make sure that moles don't turn malignant. So you want to keep an eye on the moles and teach your patient to do the same. Okay. Remember the RN scope of practice, initial teaching. The LPN scope of practice, okay? And this is state dependent, by the way. The LPN scope of practice is to reinforce the said teachings, but either way, a nurse will teach. Just review your scope of practice for your state board. Okay. Yes. We want to look at, is there any cyanosis, jaundice? What's the temperature? Should be warm, okay, and dry, and without edema. Okay. Moisture, texture of the skin. How about thickness of the skin? Mobility and turgor. Now, we are not going to assess turgor on the dorsal aspect of our hand. We will assess turgor in the anterior chest under the clavicle. Essentially, okay? Turgor is the skin's ability to return back in place when released. This reflects your elasticity of the skin. Are there any cherry angiomas that we should be worried about, right? Or they call them senile angiomas, but typically adults older than 30 will get them. We want to make sure at any bruises, we want to document any bruises, findings, lesions, palpate those lesions, right? And I already discussed the assessment of a lesion. We want to thoroughly inspect the skin. Okay. You may even need a Woods light, depending on your scope of practice. It's a fluorescent light that indicates fungal infection. If you do find any findings of a lesion, essentially, that has itching and characteristics of maybe a ringworm or tinea capitis. How's the hair distribution? What's the shape and contour of the nails? A normal nail bed is a nice 160 degree. You can find this in the chapter of your health assessment book that has to do with skin, hair, and nails. You can also Google normal shape and contour of the nail. Okay, the profile is looking at the angle of the nail base. Okay. It should be about 160 degrees. Nice and firm with palpation. Okay. Clubbing we worried about where it's 160 degrees or less, and then 180 degrees or more. Is the patient chewing their hands? Do they have chewing their nails, jagged nails? Is there, certain nervous picking habits, chronically dirty nails? That we worry about poor self-care. Cigarette use, perhaps, or certain occupations. Clubbing, we're worried about with maybe heart, lung disease, some sort of pulmonary disorder. More to come on that. Okay. You want to make sure you're palpating the skin. You're getting the assessment of the temperature. Oh, back to the nails, though. You need to look at the color. Okay. The nail should be essentially translucent. Okay. Pink. Depending on skin tone, anybody who's really darker skinned may have a brown or black pigmented area. Okay. Or linear bands or streaks along the nail bed. Everybody, okay, maybe normally may have a white hairline linear markings from trauma, depending on the cuticle. Okay. We want to check for any linear pigmentation, the black streaks, or the leukocyenia striata, so the white horizontal lines on the nails. We worry about the brown or black linear streaks, which are essentially abnormal in people of lighter skin tones, because that could equate to a melanoma, okay, like a skin cancer. Also, splinter hemorrhages um, could be a problem too. We worry about cyanosis in the nail bed or a slow CRT because we're thinking about the dysfunction of the cardiovascular or respiratory system, maybe even septic shock. Okay. We want to make sure that we're inspecting between the toes. Okay, the skin should be nice and smooth between the toes. We need to make sure we are drying our skin diligently between the toes, especially for diabetics. Okay. We want to make sure that if we notate any findings, we want to provide those findings in an SBAR format to the physician. Okay. We want to make sure that we're assessing for any abnormalities of the skin. Keratosis are raised thickened areas, essentially of pigmentation that can look crusty, scaly, like a wart. There's a particular type, seborrheic keratosis. That's kind of dark, greasing, kind of like stuck on. You may find those on the trunk, face, hands. Typically, these don't become cancerous, but you can get them from sun exposure and even without sun exposure. Okay. Are there any skin tags, which are overgrowths of skin? You can get them on the eyelids, cheeks, necks, cheek, neck, axilla. Okay. The medical term is acrochondrons or skin tags. Okay. We want to make sure that we're promoting health and wellness amongst our patients, self-care. Okay. We can teach females to do breast exams and males to do testicular exams. Okay. Now we've talked about subjective data. What is some objective data? Let's think on this. Well, I talked about the, pigmentation, warmth, dryness, smoothness, turgor, lesions, hair texture. Okay, make sure there's no pests in the head like lice. Nails, we want to make sure that there's no clubbing deformities. And the skin is essentially warm and dry. Okay. Pink, warm, and dry. Intact is what we're looking for. Okay. Now we can collect some objective data we can measure vital signs, appearance, because we're using our eyes, skin as a nice thorough head to toe assessment, head, eyes, ears, neck. Okay. Essentially, what are we doing there? Throat. Well, cardiovascular and respiratory, of course. We want to make sure that we are promoting health and wellness among our patients. Okay. It's interesting enough when the patient presents with skin presentations, it's important to understand the pattern. If your patient is presenting with a lesion, okay, are the lesions grouped? Are they touching? Is it a streak or a line or stripe? Is it linear? Okay, is it polycyclic, where the lesions sort of grow together? Do they look like targets or bullseyes? Okay, it might be Lyme disease, essentially. Are the lesions clustered? Are they spirally or snake-like twisted? You need to make sure how we're documenting the presentation. I would certainly learn the definition of macule, pacule wheals, urticaria or hives, cysts, and pustules. Okay. Crusting versus scaling. Okay. Your macules, and this is best learned by looking in the book, looking in your online resources, but those I would absolutely define. Okay. Bullous, vesicles, tumors, plaque. Understanding and seeing. I'll be, if you have me, if I'm your instructor, I'll be posting some of these resources so you can see the differences from a fissure, scarring, lichenification, keloids, excoriation, and ulcerations, right? We'll talk about wound care too, not right now, but in the future. Whenever you can measure a contusion or a bruise, a wound, you want to do so and follow your hospital and facilities policy and procedure. But that is a way to assess objective data because you can measure it, right? Knowing the definition for spider angiomas, ecchymosis, purpura, petechiae, and what a contusion is will be essential to understanding the skin, the overall health and wellness. Okay. Lyme disease, what it looks like. Kaposi sarcoma, ringworm, psoriasis, contact dermatitis, tinea corporis, herpes. Okay. You know what shingles are, herpes zoster. Cold sores, which is herpes simplex virus. Okay. Melanoma, squamous cell, basal cell carcinoma, AIDS-related Kaposi sarcomas, traction alopecia, scabies, a furuncle, abscess, hirsutism, folliculitis barbae, or razor bumps. Okay. Pediculosis capitis, hair, which is hair lice. Seborrheic dermatitis, or what we know as cradle cap. Boo lines, splinter hemorrhages, late clubbing, pitting. Those are just some of the key references to investigate. Again, embracing your spirit of inquiry, looking at these photos, findings. Again, if you have me in your class, if you are assigned to me in class, I will provide some resources and photos of some of the things that we've discussed tonight within nursing head to toe assessment related to the skin, the hair, and the nails. Okay. And again, what is the purpose of learning about this? We're learning the structure and function of the skin and its appendages, and we want to understand the rationale, essentially, and the methods for inspection and palpation, and how we can record our assessment findings thoroughly. Okay. And again, getting a printout, labeling the photo of the skin will help. Labeling the different parts or elements of the fingernail will also assist, especially for visual learners out there. Kinetic learning, muscle memory from writing or defining, even coloring essentially. Um, it's important that when you're thinking about taking notes from a health assessment that you put it in at minimum a SOAP note. You can do soapy or soapier. Currently, I'm having my students do soapier notes, especially if there's any of them going on to be a nurse practitioner. They'll already be one step ahead of the game and provide their patients a nice platform for communication to promote continuity of care as well, and communication in the interdisciplinary team and being a part of the interdisciplinary team. That's certainly important and essential, to understand what exactly health and wellness means to the patient and providing it for them. And then the next segment will include the head, face, neck, and regional lymphatics. Essentially, we'll talk about an otoscope and an ophthalmoscope regarding adults. But more to come. That'll be the next chapter or podcast that we go through. Head, face, neck, and regional lymphatics. We'll talk about the skull, some of the sutures of the skull, the head, what essentially the neck region. We'll talk about lymphatics. I generally like to talk about lymphatics when we go along with the cardiovascular system, but since we're talking about health assessment, then we're going to have it relate. Okay. And we'll talk about what's inspecting the HENT area is, the head, ears, neck, throat, essentially, right? How do you auscultate the thyroid? How do you palpate the thyroid? How do you how do you approach assessing the thyroid? We'll talk about, coming up next, some objective and subjective data. Okay. We'll even discuss migraines. It's one of my favorite portions to talk about. And we will certainly go from there. There's quite a bit of thyroid disorders we'll discuss. Maybe even we'll get into neuromuscular findings too, just depending. So thank you for listening to the podcast. I know some points we had some interruptions, but those interruptions, it's okay, guys. It's okay. All's well. Let's continue to work hard together. Take it one step at a time. Take nursing school one step at a time. Don't beat yourself up. You're doing a great job. Stick with it. Stay strong. It's not for the faint-hearted, but you can do it. Okay. Yeah. Let us continue. All right. Have a great rest of whatever time of day it is.